Hello, welcome to Dermasurgery Center. I'm Dr. Chad Prather. In just a few minutes, I'll step in to meet you in person, but first I'd like to go over a few highlights of your visit with us today. You've been referred for Mohs micrographic surgery. It's the gold standard for skin cancer. Mohs surgery offers the highest cure rate of any procedure. It allows for immediate confirmation of the cancer removal. We remove only the necessary cancerous tissue, sparing as much healthy tissue as possible, and it results in the least amount of scarring of any technique. The process involves giving you a shot of numbing medication, just like you had with a biopsy. This time we'll get around the entire cancer with a very small margin and check it in the lab to be sure it's clear. That process takes about an hour, during which time you can relax here in the room. I'll check all the edges under the microscope to be sure the roots are out. If I see the roots of cancer going wider or deeper after that first round, we'll know right away. We'll come back and make another layer around the involved area. We'll repeat that process layer by layer until we're sure the entire cancer's out. That way we can give you the highest cure rate, but spare as much healthy tissue as possible. Once we know the entire cancer's out, we'll come back and determine the best way to get you fixed up and do the cosmetic reconstruction. Of course, how we do that will depend upon the size and extent of the cancer. Sometimes it involves a simple straight or curved line of stitches. Other times it involves a skin flap or skin graft to repair the area. Occasionally we're able to let it heal without stitches at all. We'll come back and make the best determination with you once we know the cancer's out. Of course, any skin procedure involves risk, and Mohs surgery is no different. You can expect to have a little pain with injection of the local numbing medication, just like you had with a biopsy. Allergy to the anesthesia is possible, but rare. You will have some minor bleeding here in the office. We'll stop all that before you go home and send you home with bandages and instructions on how to take care of it. Swelling and bruising is very common in the first week after Mohs surgery, and you may have some discomfort after the numbing medication wears off. Most patients find that by the second or third day, the discomfort has diminished greatly. It is possible to have a local deep bruise or collection of fluid known as a hematoma or seroma. The infection rate with Mohs surgery is less than 5%, but we often will get you started on antibiotics just in case. You can expect to have scarring in the area of cancer removal. There's no way around that. But with Mohs surgery, scarring will be minimized compared to any other procedure. It is possible to have a recurrence of the skin cancer even after treatment with Mohs surgery. The recurrence rate is less than 5%, which means the cure rate is over 95%. This is the highest cure rate of any skin cancer treatment. My goals today are to keep you comfortable, get all the skin cancer out, and leave you with the least amount of scarring possible. I'll be stepping in with you in just a minute to say hello.